Good evening, dear viewers, and welcome to a new episode of Medical Talk, the program that brings you trusted medical knowledge to help you and your family live healthier lives.
Organ health is essential to life, yet for some patients, organ failure can become a serious and life-threatening condition.
Organ transplantation is one of the most remarkable achievements in modern medicine, offering patients a second chance at life.
However, awareness, early planning, and community participation play a crucial role in making transplantation possible.
Understanding how organ donation works, especially in Kuwait, can help save many lives.
So to help us better understand this important topic, we are pleased to welcome Dr. Saja Surour, organ transplant consultant and head of organ transplant department.
Dear viewers, stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatma Al-Ansari, and you are watching your weekly program, Medical Talk.
Dr. Saja, thank you so much for being with us today and giving us some of your time, your valuable time being a doctor, to be with us here in Medical Talk. Thank you so much for being with us today.
Thank you. Thank you for inviting me, and I'm honored to be here with you today.
Dr. Saja, we're going to talk today about the organ transplantation in Kuwait. So can you tell us the current state or status of the organ transplantation in the state of Kuwait?
Yeah, actually, we're doing very good in the transplantation section in Kuwait. Compared to the previous years, we made a jump from the organs we're providing, from our techniques, from the rate of transplantation. It's improved dramatically during the past 10 years. So as maybe you know, or the audience don't know, we started in the early 80s, and the rate was around 80, maximum 90 cases per year. But within the past few years, we did a tremendous change in many aspects of our techniques and legislation that improve the service in Kuwait.
That's amazing.
Dr. Saja, which hospitals or centers in Kuwait perform organ transplant procedures?
So we're doing kidney transplantation at Jabir Hospital.
Okay.
We're doing heart transplantation at the Bus Center in Adan Hospital.
Wonderful.
Dr. Saja, what's the most common organs to be transplanted in Kuwait?
Most commonly is the kidney.
The kidney. Out of the all organs that to be transplanted, the kidney is
the most famous one.
So is it usually kidneys, and what's maybe three most common? Maybe kidneys and liver, maybe?
From our living donors, it's obviously only the kidneys, and from our deceased donors, we have a harvesting, or what we can call it a procurement team, as widely worldwide happening. They procure the heart, kidneys, pancreas, livers, lungs, and yes, I didn't mention that we are on the way of establishing the lung and the liver, hopefully in the near future.
Shall, hopefully.
So as organ donations from deceased donors, is it widely practiced in Kuwait, or usually mainly from living donors?
You would be surprised that it was a very, not rare, like before the 90s, we can get maybe 10 per year, 10 donors per year. But at the end of the 90s, when we actively opened the road, or we spoke to the concerned people, we improved it, and since 3 years ago, it's 50%.
That's remarkable.
It's really something very nice.
Dr. Saja, we're talking about donors. What organs can be donated without affecting maybe the person who is donating the organ?
Yeah. So it's the kidney mainly, and we always reassure the donors that donating a kidney makes you almost as healthy as a normal person, because many people are born with one kidney and they won't notice it until very being old in age. So after donating a kidney with taking care of the the blood pressure and the sugar, people can live normally for the rest of their lives. And the other organs is the part of the liver we can donate.
So part of the liver and kidneys.
And kidneys.
Even the donor, you said, sometimes can be even healthier after.
Yeah, well, actually, there are some studies. It's kind of funny because the donor is gonna be followed for the rest of his life, and we can catch any things not related to the transplant. We can fix it. So basically, he would be like taken care of much more than the healthy person who will forget to check on himself like regularly.
Oh, wow.
That's amazing.
Yeah.
Well, Dr. Saja, thank you so much for these valuable information so far. But
Yeah.
we are still continuing with this interview after this short break. Dr. Saja, we're still talking about organ transplantation. What ethical regulations govern the organ transplantation, maybe as a whole? Like there's any ethical regulations governing it?
In Kuwait, we practice a very strict regulation that have been approved from the Ministry of Health, from the legal point of view and ethical point of view. Our selecting mostly for the part of the disease donation, the donor has to go through steps to be accepted as a donor, legally and ethically.
Maybe sometimes the donor himself, maybe they're not fit to be donors, right?
Yes, exactly. Yeah, there are some criteria for the donors, especially the living donors. First of all, they must be healthy. So we cannot take a donor who has high blood pressure or diabetic or morbidly obese, because these will affect the kidneys later. Also, the age. There are some age limitations, like above 21, and there should be no psychological issues with the donor, so to be fit to be a organ donor. Yeah.
Well, Dr. Saja, I'm sure a lot of our viewers are interested about where to donate their organs.
Yeah.
For citizens and residents living here in Kuwait, where would you advise them to go to register?
So for the living donors, we're talking about the family. So when a patient comes, we ask them, do you have any member of your families or dear friends, close friends that would like to donate? That would happen in our hospital. But for the disease donation, if anyone wants to donate or have a card for donation after brain death, they can go in person to apply in the Kuwait Organ Society or by their hotline.
Okay.
Yeah.
Dr. Saja, what are the main challenges that faces the organ donation awareness in the Kuwaiti society?
Yeah, the most challenges we're facing is the lack of exposure, lack of media exposure. Some people or some the people holding the social media or regulating things, they sometimes avoid it because it's a sensitive area.
Sure.
So they want to avoid the conflicts and things but we are trying with the Ministry of Health to make it as popular as donating blood. So you're donating a blood, why we don't encourage people to donate organs after brain death?
Sure, that's the same challenge, basically.
Exactly.
So that is part of my next question is what does the media play a role? Do you have do you have campaigns to raise awareness for people?
From time to time we're doing campaigns. We're going to the mall, the shopping malls. The last one we did in avenues, and we collected 17,000 donating cards. Yes,
that's very
It's
impressive.
a very, very big number. We didn't get this number before. Also, we're going to schools, high schools, universities, some of the ministries. Sometimes we make a corner or a booth to speak about our donation and yeah, applying for donation.
Are there any statistics? I was actually going to ask you if there is any statistics and recent improvements
Yes.
in organ transplantation.
Yeah. So we are obliged to make our statistics because there is the WHO and the United Nations that demands an annual statistics from all the countries. I can proudly say that from, as I said earlier, from the 80s till early 90s, and even till the early 2022, the rate of donation or transplantation is 80 to 90. In some years, we will reach 200 cases per year. This is about the kidney transplantation. But on 2023, we made it 150. That is 50% increase in 1 year. And this happened after modifying our approach to the families of the deceased donors,
Yes.
the campaigns, all I can say it's because of the awareness that increased our rate.
It's very effective. It means that the campaigns are working.
It is, it is. It has a big effect. Yeah. Also, when we moved, we before the program was started in Sabah area in Hamad Al Isa Hospital, and since we moved to Jabir hospitals, it has been a big change for us because we saw that multidisciplinary teams make a big and huge difference than being a solitary center, and we noticed that even the sending the patient abroad, boarding the patient outside, like decreased to almost like 2%, like, and before it was almost 50%, because we started to do more complex cases with the support of our intensive care unit, our vascular surgeons, and the help of all the multidisciplinary teams in Jabir Hospital.
I'm amazed by the numbers you mentioned before, and I hope people continue to donate their organs and even their blood, anything to help each other in our society. Thank you for this information, Dr. Saja. Well, dear viewers, we still have more to go after this short break. Welcome back, dear viewers, to Medical Talk. We're still with Dr. Saja and Dr. Fatma talking about organ donation here in the state of Kuwait. Dr. Saja, for our final question, is there any message you want to say to encourage organ donation here in Kuwait?
Yes, I would like to encourage people to consider donation as it's more than just helping one person. But you know, when you have a sick patient, it's not only him suffering, it's the whole family suffering. And by donating an organ to him, you will cure him, and you will relieve and improve the quality of life for him and his family. And also, after the brain death or the disease donation, when the person donates, he's not getting an organ to one person. He's giving an organ for seven patients. It's heart, kidneys, liver, pancreas, intestine. It's something amazing that he's giving a life for 7 people.
Yes.
And it's something very, very huge and something very important for like a return back to the humankind.
Definitely, absolutely.
Yeah.
Well, thank you so much, Dr. Saja, for this message. And I also hope people would continue to donate their organs and help each other, so everyone can have a chance to survive in this world.
And keep raising awareness.
Yes, thank you very much.
Thank you.
Well, dear viewers, that brings us to the end of this interview, but stay tuned. We still have more segments in Medical Talk after this break.